Asanteni wenzangu. Kisumu hamjambo? Kisumu hamujambo? Kisumu oye! Asanteni sana. Mutaniruhusu kwanza nisome ile tuko naye hapa kidogo kuhusu yale ambaye ni ya muhimu na imetulete hapa. Alafu pia nipate nafasi kidogo ya kuongea mengine ambaye inatuhusu sisi wote kama Wakenya. Ni sawa? Asanteni sana. Fellow Kenyans, today marks a key milestone and a historic journey for our nation as we inch closer towards the realization of health for all. The proclamation towards universal health coverage demonstrates Kenya's commitment to ensuring investments are made towards the enjoyment of the highest attainable standard of health as enshrined in Article 43 of our Constitution. The proclamation also sits squarely within the country's blueprint for social economic development and shared prosperity. The Vision 2030, which envisions a society in which no one is left behind. This proclamation also resonates strongly with the global community's aspiration as outlined in the Sustainable Development Goals. Today, therefore, marks the actualization of Kenya's full commitment to SDG Goal 3 on ensuring healthy lives and promoting well-being for all. Fellow Kenyans, my administration recognizes the social and economic challenges that Kenya faces due to the cost of health care. The prohibitive costs of accessing health services has regrettably pushed at least 1 million Kenyans below the poverty line every year, with many others left at the brink of financial ruin. Furthermore, the consequences of ill health are a deterrent to the optimal growth and development of our children, the well-being of our pregnant women, and the survival for those with chronic diseases, as well as the elderly. All this impacts negatively on the productivity of our nation. For this reason, Kenya joins the rest of the world in aligning with primary health care approach that was declared in Astana in October this year during the Global Conference on Primary Health Care. Access to quality primary health care can address over 80% of a person's health needs throughout the life cycle by focusing on preventative and promotive health interventions. We must therefore endeavor to build resilient and responsive health systems that guarantee equitable access to health for all. Since 2013, my administration has focused on the following investments in health. One, the removal of user fees at dispensaries and health centers, which has led to improved access to primary health care services at that level. Two, the institution of the free maternity program, now known as Linda Mama, eliminating maternal health cost barriers for poor and vulnerable women. And three, equipping 2 hospitals in every county with equipment for specialized treatment that previously caused Kenyan patients and their families to travel long distances and high costs. For the provision of health insurance subsidies for over 200,000 households countrywide. While these interventions have shown tremendous benefit to the health of Kenyans, we must now go further. Our journey towards universal health care coverage, which has also been christened Afya Care, has reached a critical milestone today as we launch the pilot phase in the counties of Kisumu, Nyeri, Isiolo, and Machakos. The pilot will elicit critical lessons that shall inform the scale-up to the rest of the country. Starting now, all Kenyan residents in the 4 pilot countries with a UHC or the Afya Care Card will have access to free health services across county public health facilities. The range of essential health services will include emergency services, child health services, maternal health services, mental health services, infectious disease management, non-communicable disease management, inpatient and outpatient services, and community health services. The government will disburse a total of an additional 3.1 billion towards the Afya Care initiative. These resources will be invested in the public health facilities to strengthen the delivery of primary health care. This approach will prioritize the promotion of health at the household level through public health education and through the engagement of community health workers who shall provide the very basic of health services. In addition, resources shall be invested in the Kenya Medical Supply Authority to ensure that all those who fall ill can find quality medicines at public health facilities. During the pilot phase, the other 43 counties, as was put forward by the chairman of the Council of Governors, will be engaged in health system strengthening in anticipation of the countrywide scale-up. In addition, various ministries outside the health sector will play a critical role in creating an enabling environment for health, such as the provision of water and electricity to all health facilities. This multi-sectoral collaboration will be critical to the success of the pilot phase. In order to realize the envisioned success of this initiative, we require an equitable and efficient strategic purchaser for health services for all Kenyans. I therefore, as we have seen problems, also today direct the accelerated institutional reforms, starting with the National Hospital Insurance Fund. We should see that Kenyans who require care at the national referral hospitals can access it. Iwe sio ya kuweka pesa kwa mifuko yao, lakini ni kuhakikisha ya kwamba Wakenya ambao wanataka matibabu wanapata matibabu. In addition, to boost efficiency, all publicly financed insurance pools should be collapsed into a single pool. Further, we will need to ensure the sustained supply of essential medicines and medical commodities at all our public health institutions. So equally, we must direct also reforms in the Kenya Medical Supply Authority to allow for an uninterrupted supply of quality essential medicines and medical commodities, leveraging on existing technology to forecast needs and to manage logistics. And also, as I have said, the primary providers of healthcare are the counties. And KEMSA board must have representatives from the counties in order to ensure that there is total transparency. Taking cognizance of the ever-rising cost of healthcare, we also say that the ministry, together with stakeholders in the industry, should create the necessary institutions that shall allow for the economic evaluation of investments in health and to set tariffs that shall protect Kenyans from market exploitation. Devolution provides a unique opportunity to address inequities and inefficiencies in the health sector. To fully gain from the decentralization of health services, I also urge our county governments to match investments from the national government with commensurate investments in human resources for health, and I am happy to hear that they are moving up to 30% of their budgets that shall be dedicated to healthcare. The health workforce constitutes an essential component to the success of this initiative, and I laud totally the collaborative efforts demonstrated by the leadership of the 4 pilot counties with the Ministry of Health, and urge for continued engagement to ensure equitable distribution of resource. The sustainability of this initiative is also pegged on a conducive legislative environment that ensures that resources allocated for public goods are retained as such. And I therefore also call upon the National Assembly and the Senate to fast-track all legislation that will secure this initiative for Kenyans today and for generations to come. I would like to acknowledge the immense support that our country has received from development partners as we articulated the strategy to achieve the agenda on universal health coverage. In particular, I note support from the World Health Organization that was represented here by their Director General, Dr. Tedros. I implore all our development partners to continue in this spirit and align to the universal health coverage as outlined in our medium-term plans. Ladies and gentlemen, in conclusion, they say it takes a village to raise a child. The universal healthcare journey is at its infancy today, and we all have a part to play for it to attain full maturity. Let us join hands and ensure that Kenyans can enjoy the highest attainable standard of health without suffering financial devastation. With these few remarks, I now declare the initiation of the Universal Healthcare Pilot Exercise officially launched. Afya Care, ni wema wa Mkenya na Mungu awabariki.